All right. So good morning, everyone. Welcome to PhysioBrain Quiz, where knowledge meets fun in the exciting world of physiotherapy. My name is Dr. Ria, and I'll be your quiz master for Group 1. We have an exciting lineup of questions that will test your knowledge and spark your curiosity. Before starting, I would like to quote, "The joy of competition is in the process of learning and not in the outcome." Now I will just go through the general rules for this quiz. Please ensure there is a stable internet connection and a device. All the participants should be seen on the screen at all the times. If there is a tiebreaker round will be held to determine the winner. Participants must answer the questions without external help or consulting online resources. Maintain a respectful tone in all communication. Any form of disrespectful behavior may lead to disqualification. Any participant found violating the rules or using unfair means will be disqualified. Also, note that questions will not be passed on to the next team if the team which has been asked the question is not able to answer. There will be no negative marking in any of the rounds, and points for each round will be carried forward to the next round. Okay. And after every round, the team that is eliminated will have to leave this meeting immediately. So let's get started. Is everybody able to see the screen?
Sure.
All right. So we will start with our first round, that is anatomy of answers. The rules for this round is that each team will get 20 seconds to answer the question after it has been read out. Correct response to the question will fetch you 10 points. If there is any incorrect answer or the time is up, you will get 0 points. Decision of the quiz master is considered to be final decision. And so in this, what we will be doing is one question will come to team A, then next question will go to team B, and then to team C. So you will have to likely mute and unmute yourselves. Okay. So we will start with the first question, which is for team A. Which ion is primarily responsible for the depolarization phase of an action potential? Potassium, sodium, calcium, chloride. Team A.
It is sodium.
Option A, sodium.
Option
Correct.
B is sodium. Option B
Correct.
is
B,
sodium.
sodium.
Second question for team B. Team B, the masseter muscle is innervated by which nerve? Facial nerve, trigeminal nerve, glossopharyngeal nerve, accessory nerve.
Option A, facial nerve.
The answer is wrong. It is trigeminal.
Request team C to come on video.
Next question is for team C. Team B, please put on your video. Next question is for team C. Which type of cells in the cerebellum are known for their inhibitory influence on the output neurons? Purkinje cells, granulate cells, basket cells, mossy fibers. Time up. You will be getting 0 points. Next question is for team D. According to the pain gate theory, where is the gate located that controls the transmission of pain signals to the brain? Spinal cord, thalamus, cerebral cortex, brainstem.
Option A, spinal cord.
Correct answer. The next question is for team E. The tract of Burdak is also referred to as fasciculus gracilis, fasciculus cuneatus, spinocerebral tract, rubrospinal tract.
That will be option D, rubrospinal tract.
The answer is wrong. It should be B, fasciculus cuneatus. Okay. Now we will go for the second round of the quiz. Okay. Similar kind of questions will be played. Only we will be starting with team A again. Okay. So next question is from team A. In a basketball jump shot, which of the following muscles contributes significantly to the explosive upward motion of the jump? Gastrocnemius, hamstrings, rectus femoris, gluteus medius.
Option A, gastrocnemius.
The answer is correct. The next question is for team B. Team B. In the context of a patellar tracking disorder, which muscle imbalance is most commonly implicated? Weak quadriceps and tight hamstrings, weak vastus medialis oblique and tight iliotibial band, weak hamstrings and tight quadriceps, or weak gastrocnemius and tight soleus.
Option B.
The answer is correct. The next question will be for team C. During a side plank exercise, which of the following muscles provide the primary stabilization of the trunk? External obliques, internal obliques, rectus abdominis, gluteus medius.
Option C, rectus abdominis.
The answer is correct. Then, the right answer is gluteus medius. You'll be getting 0 points for this. The next question is for team C. For team D, what is the primary role of antidiuretic hormone ADH? Increase urine output, decrease blood pressure, increase water reabsorption in kidneys, or stimulate digestion?
Option A, increase urine output.
The answer is wrong. It is increase water reabsorption in kidneys. Next question is for team E. In the context of a patella tracking, uh, just a second. Extremely sorry for the technical issue. Please hold on. Okay. So since one of the questions was repeated, I will give an alternate question for team E. What is the insertion of biceps tendon? A. Coracoid process. B. Radial tuberosity. C. Olecranon process. D. Greater tubercle of humerus.
Radial tuberosity, please.
Yes, the answer is correct. Just give us a minute to tally your scores. We'll let you know the elimination of this round. Okay, so in the round one, that is anatomy of answers, team A has scored 20, team B has scored 10, team C has scored 0, D has scored 10, and team E has scored 10. So with this, so team A, B, D, and E are qualified to go to the next round. Requesting team C to please leave this meeting, and thank you for participating. So our next round is beyond physiotherapy. The rules for this is each team will get 20 seconds to answer after the question is read out. Correct response will fetch you 10 points. Incorrect response time or time up will be 0 points. And kindly answer the question which is given to you. Okay, so the next question is for team A. Name any two authors of the book.
O. Sullivan and the second.
Time up. You will be will be for team A. What does CDC in the displayed logo stand for?
Uh, CDC, Center for Disease Control. Am I audible?
Yes, yes. But
It is Center,
the answer is
Center for Disease
incomplete.
Control.
The answer is incomplete. It is Center for Disease Control and
Disease
Prevention.
Control and Prevention.
You'll be scoring 0 points for this. Next question is for team B. With which association is the displayed logo associated with? Time up. The answer is World Health Organization. The next question is for team D. Team D. With which association is the displayed logo associated? Time is up. You will be scoring 0 points. Next question is for team E. With which association is the displayed logo associated?
Paralympics. Paralympics.
The answer is correct. So I will be announcing the scores for the second round, that is beyond physiotherapy. Team A has scored 0. Team B has scored 10. Team D has scored 10. Team E has scored 10. So team B, D, and E will be moving forward for the next round. I'm sorry, team A has been disqualified.
You said the points will be carried from the previous round. So does that apply or not?
Oh, yes, yes. Just a second. Okay, so with this, when I am calculating the scores for overall, so all the teams are scoring a score of 20, for which we will be having a tiebreaker round now. So we will start with team A. Just give me a minute. Okay, so the game that we will be playing as tiebreaker is as follows. So I will be giving you any alphabet. Okay, for example, it may be A. So with any letter or anything that is associated with physiotherapy or medicine can be named out, which starts with A. Okay, for example, if I say A, it can be acromion process, anatomy, alveoli, anything. Okay, for this, you will be given 1 minute. The team to be able to list out as many as names will win, but make sure that in that 1 minute, if any team gets stuck in between, it will be disqualified for this round, not as in total. uh, or if there's any repetition of the names that you're taking, that team will be asked to stop there. Okay. So we will start with team A, and the alphabet for you is S.
Ma'am, everyone has to answer at the same time, or you'll ask a particular team?
Particular team.
Particular team for team A.
Ma'am, can you repeat the alphabet?
Okay, I had said it already, so I'll change the alphabet for you.
Okay.
The
Okay.
alphabet is T.
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 Teres
Uh,
major, teres minor, thoracic cage, thoracic inlet, trapezius, traction,
thoracic spine,
tendon,
thrombosis,
thrombosis,
trauma, taping,
tissue
thrombolysis,
thrombolysis,
tibia,
tendinopathy,
trigger point,
trigger,
torticollis.
tendinitis.
tibial
Okay, you
tuberosity.
have repeated tendinitis.
Sorry?
Hold on, you repeated tendinitis.
No, ma'am, there are two different words. That is tendinopathy and tendinitis.
Yeah.
Yes, but tendinitis has been said
Temporomandibular.
repeated twice. I'm sorry, I have to stop you. Tendinitis has been repeated. Okay, so the next team is team B. For you, the alphabet is C.
Coracoid process,
Coracobrachialis, cardiac, carotid, cerebrum,
cerebellum, cardiac arrest,
cornea.
Okay, since you have taken a break, since you took a break, we will have to ask you to stop there. Next team is team D. The alphabet for you is M.
mandible, muscle, ossifigals, muscle, masseter, movement, movements, momentum,
Okay, since you have taken a break,
myofascia,
we'll stop you there. Team E, the alphabet for you is O.
Osteoporosis,
osteoarthritis,
osteopenia,
osteoarthritis,
osteoclasts, osteocytes, oral cavity, osteopenia, orifice,
Okay, since you have taken a
Momentum.
pause, we'll stop there.
Alright.
Give us a minute to calculate the score for this. Okay, so for this tiebreaker round, Group A has given 18 names, Group B has given 8, D has given 8, and E has given 10. So we will have a tiebreaker round for B and D again. Okay. So team B, please put on your cameras. Team B, turn on your camera. Okay. So we will be playing the same game again. The alphabet given to you is B.
Can you repeat?
Alphabet is B.
B.
B or P, ma'am?
B for ball.
Biceps,
bronchi, brain,
brachialis, brachioradialis,
bladder,
bladder, then
breast,
breast,
brachial plexus, bronchitis, bones, and
brain,
Since you have taken a pause, we'll stop there. Okay. Next is team D. Uh, the alphabet for you is D. D for doll.
deltoid, dynamic, dorsal column, dorsiflexors, dorsalis pelvis, dynamic gait, diaphragm, dynamic balance, diencephalon, dance therapy, dual tasking, dimensions, Dina Gardner, diseases,
We'll stop there. Just give us a second. So team B has given us eight names and team D has given us 11. So the teams to qualify will be A, D, and E. Team A, D, and E are qualified for the next round. Thank you for participating, Team B. You can please leave this meeting. All right. So we are left with Team A, D, and E. So the next round is real rhythm and rally. Each team will get 20 seconds. Correct answer will fetch you 10 points. Incorrect answer or time up will fetch you 0 points. No image will be passed forward. And you will be having 4 questions this time. Each team will have 4 questions. Okay, so we will start with team A. Identify this image.
Prosthetic leg.
It is a Jaipur foot.
But it is a prosthetic.
But ma'am, it
Yes,
is a
but you have
prosthetic.
to be specific.
Acha, okay.
Okay. So next question is for
Okay.
team D. Identify this image.
hip, knee, ankle, foot orthosis.
The answer is incorrect. It is knee, ankle, foot orthosis. Okay. Next question is for team E. Identify the image. Please unmute yourself.
Finger or
Sorry, the answer is incorrect. It is knuckle bender. Next question is for team A. Which method of application is shown in the image?
short wave dithermy, SWD.
Which method of application is shown in the image? Was the question. The right answer was crossfire method. Next question is for team D. Which method of application is shown in the image?
Direct immersion of PWB.
Correct. The next question is for team E. In which electrotherapy modality is the device shown is used?
Infrared radiation.
The answer is incorrect. It is a disc electrode for SWD.
SWD.
Okay. So the next question is for team A. Identify the equipment shown above. The time is up. The answer for this question is pereniometer. The next question is for team D. Identify what type of instrument is used in the image.
Ma'am, we are not able to understand the question.
What instrument is used in this image? What equipment can you see?
Ma'am, there are two instruments, like
It is all a part of the same instrument. Sorry, the time is up. The answer is bioimpedance analyzer or BIA. Next question is for team E. Identify the above shown device.
Nebulizers.
It is a Hudson chamber. Next question is for team A. Identify the finding.
फाइंडिंग बोल रहे क्या हुआ है उसमें डिसलोकेशन ऑफ शोल्डर डिसलोकेशन
It is shoulder dislocation.
Okay.
And
Yeah, it is a question.
ma'am, we have to,
you have to specify the dislocation
do we have to
Yes,
specify
please.
the dislocation?
Oh, okay. Yeah.
Yeah, it was supposed to be a specific this thing.
Okay, we know.
Inferior shoulder dislocation.
Inferior shoulder dislocation.
The answer is incorrect. It is posterior dislocation or bulb sign. The next group is team D. So the team D will be answering the next question. Identify the fracture.
distal radius or Colles fracture.
The answer is correct. The next question is for team E. Identify the condition shown in the image.
Pneumonia.
The answer is incorrect. It is pleural effusion. Okay, we are done with this round. Let us tally the scores and we'll let you know. Just give us a minute. So for the third round, that is real rhythm and rally, team A, along with the cumulative score, has scored 20. Team D has scored 40 and team E has scored 20. So we will have a tiebreaker round for A and E. Okay, we will be playing the same game, tiebreaker game that we have played in the last round. Okay, so team A, your alphabet is F. Please unmute yourself. Please unmute yourself.
Fracture, fascia, flexion,
Fasciculus
frozen
laceralis,
shoulder,
fasciculus tuberculosis,
fibrosis,
Foot drop, flat
flat
feet,
foot, fasciculation, femur,
friction
friction massage,
fibula,
functional range,
fibrillation, femur, fibular nerve, fasciitis,
facial nerve,
foot orthotics, flexibility, forearm, foot pronation,
flexion
हो गया flexion हो गया है.
Flexion is
Uh,
done. So
Yeah,
we'll
yeah,
have to
that's what
stop you
I'm telling.
there.
Infection हो गया है ना?
Yeah.
ठीक है, it's okay.
So we'll stop you there. Okay. The next team is E, and the alphabet for you is R.
Rheumatoid arthritis, radius,
Rubella,
rhinovirus,
rhinitis, retina,
Okay, you've taken a pause there. We'll stop you there. So team A was able to give us 20 names. Team E has given us 6 names. So with this, team A is qualified for the next round, along with team D. Thank you, team E, for participating in Physio Quiz. We will start with the round 4, that is rapid fire round, and the last round for today. The team winning this will be going into the finales. So the rule for this game is that each team will get 90 seconds. Okay. Each correct response will give you 10 points, and incorrect or incorrect responses will give you 0 points. And one more thing I would like to add is, in the 90 seconds that you have been given, you have to answer as many questions as possible. The team which will be able to answer as many as questions in this round will be the winner. Is that understood? Is it understood by both the teams?
ma'am, just a question. Like,
Yeah.
questions will be asked to particularly one team, or ऐसा होगा कि
we
questions
will-
करेंगे हम तो
Okay. Okay. So I will be giving 90 seconds to team A, for example. So team A will finish all the questions in that 90 seconds. Okay. How much ever they are able to answer. All right. And then next will be team D.
Yeah,
Yeah.
ma'am. If in the 90 second, if we answer a wrong question, the timer will not
That
stop.
will be,
Right?
no, it will not stop. You will be given the next question. Okay. So let's start. Anybody has any queries?
No,
Team D? Okay, let's start. So we'll start with team A. According to WHO, what is the cutoff range for a person to be called obese?
According to WHO, what is our current
30. BMI 30. Above BMI 30.
Which
Which
orthosis is used
orthosis?
for treatment of wrist drop?
wrist drop? Which orthosis is used for? Which orthosis is used for the treatment of wrist drop?
Next.
Which outcome measure is most commonly
Which out-
used to assess disability in patients with low back pain?
Which outcome measure is mostly
Measure.
used commonly disability with lower
Next.
What serum lab test is the most accurate representation of blood sugar control for 3 months?
Serum lab test is the most accurate representation.
It's serum test.
Think blood sugar.
The answer is HbA1c.
Next.
Okay, next.
What is the primary function of a triode in electrotherapy equipment?
What is
Triode.
triode in electrotherapy equipment का मतलब उसमें function चाहिए.
Treatment.
Function इसका
Next. Anil, Next, ma'am.
Which criteria is used to classify PCOS?
Which criteria?
Sorry, the time is up.
Siri.
Okay. We will start with the other team. Team D. Team D, you ready?
Yes, ma'am.
Okay. What does the Hoffman's reflex indicate?
UM and lesion.
The answer is cervical myelopathy. The knee joint ligament which gives restraint in the maximum directions is?
ACL. ACL.
The answer is MCL. Which condition occurs when nerve conduction is affected by diabetes?
Neuropathy. Diabetic neuropathy.
Correct. Which international organization provided guidelines for physiotherapy practice during the COVID-19 pandemic?
WHO.
Correct. How do you assess the motor function of the 11th cranial nerve?
Spinal accessory. Trapezius shrugging.
Okay.
Shoulder shrugging.
Which spinal movement involves the patient bending sideways to one side and then the other side?
Lateral rotation.
Lateral flexion. What specific pulmonary function test is typically reduced in restrictive lung disease?
Pulmonary restrictive lung disease में FEV1. FEV1.
The answer is FVC. Name the condition that commonly occurs in runners in which runners presents with pain.
Runners.
Specific. No, the answer is shin splint or medial tibial stress. Prolapse of the bladder is known as?
Okay,
Okay, the time is up.
Cystocele.
Time is up. Just give us a second for tallying your scores. Okay, so Team E has a cumulative score of 30. Team D has a cumulative score of 80. So Team D will be eligible for going to the finale, which will be conducted on 4th of September. Further instructions will be given to you on the group. Thank you for joining.
Thank you so much.
Thank you, ma'am. Thank you.
Thank you. You can leave the group.